also known as navel bleeding, belly button bleeding, can be caused by several issues, with an infection being the most common. In some cases, the bleeding may be triggered by injuries sustained during the course of an accident. The course of treatment used to treat belly button bleeding will depend on the underlying cause, the severity of the situation, and what is required to stop the bleeding and expedite the healing process. The incidence of belly button bleeding often follows earlier symptoms that indicate the development of an infection. Typically, the first sign of an infection may be some swelling and discoloration of the skin around the belly button. From there, discharge of some type may occur. As the infection progresses, small ruptures in the navel will allow blood to seep into the discharge. The degree of blood may range from a little spotting to a steady flow, depending on the progress of the infection. There is also the possibility of belly button bleeding developing as the result of some sort of accident or trauma involving the abdominal area, just as there may be bruising to the muscles in the abdomen as well as damage to surrounding blood vessels. The navel may also be compromised to the point that there is some seepage of blood. Trauma to the abdomen associated with surgical procedures may also trigger some bleeding in and around the belly button during the course of recovery. In cases in which belly button bleeding is caused by the presence of an infection, the use of medication to deal with the infection is often necessary. Depending on the severity of the problem, oral antibiotics may be sufficient. With more advanced situations, the use of intravenous antibiotics may be required. In addition to medication, keeping the belly button clean and dry will also promote healing and gradually reduce the level of bleeding. While belly button bleeding can be a cause for alarm, the condition can be treated with relative ease. An examination by a qualified physician will help to identify the root cause for the problem. When an infection is involved, the physician can identify the type and severity of the problem, determine the right type and dosage of medication to use for treatment, and monitor the progress of the healing. Seeking medical attention when the bleeding is first noticed, even if no other symptoms are present, will help to prevent the infection from spreading and causing additional issues that complicate the healing process.